Welcome to the Susan Brender Show. It's all about you, featuring shows on health and wellness, the performing arts, politics, and people who inspire you to be your very best. And now, here's Susan Brender.
I'm Susan Brender, and this is the Susan Brender Show. Today, my guest is Dr. Xiao-Mei Zeng, who offers comprehensive care as an OBGYN in Palm Beach County, Florida. Now, Dr. Zeng, it's very important to ask you this because I want to understand, why is your practice such a thriving practice? Why do people love you?
Thank you very much for inviting me, Susan. The reason why we are more comprehensive than the others is because that we emphasize the whole person. And what happens is in Western medicine and the Eastern medicine, this is where it meets. And Western medicine is designed to treat diseases and less prevent diseases. We all talk about to patients, exercise, diet, encourage people to go on the right diet and do more exercise. And Eastern medicine, we do more. We take the person holistically. So in my practice, I talk to patients about acupuncture. Myself, I have experienced, I have learned acupuncture since 1997. I spent 3 months in Beijing orthopedic acupuncture school. Mm-hmm. At that time, I have seen patients who had experienced strokes from the time they're laying down and cannot eat, and go through acupuncture and improve their health. Within 3 months or 6 months' time, they can stand up, walk, take care of themselves, which is really, really important.
Right.
However, before we get to the stroke, we need to take care of the body. There's so many things you can prevent apart from the blood pressure, diabetes, cholesterol, which is really, really important when you are postmenopausal, or for men to be taken care of by Western medicine. The Eastern medicine, we also do a little bit more. People have arthritis, people have headaches, people have backaches, people have menstrual cramps. And even in obstetrics, we use acupuncture to decrease the pain, as well as induction labor. And if the baby is breech, we use acupuncture to turn the baby after 38 weeks.
It's an interesting thing, Dr. Zeng. Here you are talking about acupressure, or rather acupuncture, and what you're saying is that you find it to be a very, very important part of people's health care, because it obviously has had an impact on their health, and you have witnessed this yourself. Now, you are indeed a traditional doctor, and you work with thousands of patients, and you've probably delivered thousands of babies. Now,
correct.
Okay, now from the time that you started doing what you did, what you do, to now, is there a difference in the way that you handle yourself and the way the knowledge that people have today as compared to the way it was when you just started?
Definitely. I've been practicing OBGYN in Palm Beach County, the same location, for the last 22 years. When I first started, I do traditional medicine, OBGYN. I take care of from the very young, the puberty up to 90, 100, okay?
Wow.
And I do the pap smears, I do the STD checking, and I love the young people when they come through the door, when they're teens and 20s. Because of the fact that I had a 2 years experience as a teacher, I really try to guide them through life, especially from the time that they started even looking at somebody intently or want to spend some time, private time with a boy. And that's when you start, as a parent or as a teacher or as a doctor, emphasize to them there are things in life you got to protect yourself, such as a pregnancy, such as prevent the sexually transmitted diseases. And also, it's very important to tell these patients that in this day and age, bullying is really a really terrible thing that affect the young kids, their psychiatric health. Yes. So I always tell my patients, if they are in a situation where they're separated from their loved ones, their best friends, their family, and they're being made so small and only rely on one person, that's the only person, that person has the tendency to abuse them. They need to run away from that person.
There you go. Take into account not only the physical side of people's situation or bodies, but you also pay attention a lot to the psychological side of things. And do you consider that a very important way to treat people?
Oh, very much so. I feel that when somebody is psychologically abused or going through a situation in life that they feel like they lose control. And that's where their cortisol level is increased. And that cortisol level is really damaging to your body because it decreases your immune system. A lot of times I see patients in their, maybe they're taking care of their loved ones who's really ill with a cancer. They forget about themselves, or people who are having parents who are ill with Alzheimer's. They're the only caregiver, and they themselves forget themselves. So what happens is that these are the people who are, I'm watching them very carefully, because these are the people who may have worsened pap smears, such as cervical cancer or uterine cancer or breast cancer or colon cancer. Because if you take care of your body, like exercise, diet, and be happy, be positive, and all these diseases tend to go away because your body takes care of yourself. But when you are in a situation where you cannot take care of yourself because you're helping everybody else, or if you're in a situation going through divorce or things like that's very detrimental to your health and the environment, and you forget about yourself, and that's how your body self-destructs.
So you're talking about stress is what you're discussing here. It sounds like, honestly, people are dealing today. I mean, we're talking about a lot of young people who are actually working harder and harder and harder because of the notion that money is such an important thing. And as they do that, if based upon what you say, they're actually doing harm to their bodies.
Correct. Yes. But I think there's a trend nowadays in the young people that there are more and more people who are thinking that the material things are not that important, and they want to be minimalist, which means they don't need to buy so many clothes. They don't need to buy so many pairs of shoes or purses, things like that. And I see a good trend that a lot of people are doing yoga or Pilates or Tai Chi. On weekends, I see a lot of people are running and doing exercises. And even my medical students, they watch what they eat. And, they tell me, Dr. Zeng, you got to watch your carbs and sugar. And those are very positive signs I see in the young generation.
So you now just brought up another subject, which is the subject of nutrition and how how nutrition can also be either detrimental to one's body or it can be very positive and can play a big role in health. And as a obstetrician gynecologist, when it comes to nutrition, how do you give people the information that's necessary, and what do you say to them about nutrition? Because as we talk, I think about all the articles that I see in the newspaper and all the different companies which are trying to indicate that they offer very important things for the body. So what's your thoughts on that?
Well, my thoughts are there are people who are taking all kinds of diets, right? Where right after New Year's, and there's advertisements, different kind of diets, and the South Beach diet, keto diet, different programs. The key is to change your lifestyle. That is, it is really important to see what you eat. A lot of times I ask my patient, when my patients sit in front of me, they have a weight problem, and I ask them, what do you eat in the morning? And a lot of them, nurses especially, teachers or different people who are really busy, they don't eat anything. And that's wrong, because you need to eat breakfast to increase your metabolism. And then people who do eat, sometimes they say, oh, I have a cereal, Lucky Charms, things like that. And nothing wrong with the Lucky Charms, but they have a lot of sugar. So what you eat in a breakfast, you got to have protein. You got to have eggs, and oatmeal is fine, but the protein aspect is very, very good.
Yeah.
And also, go ahead.
No, I was thinking, because at the beginning of the show we were talking about your experience in China and the Chinese diet, which
right.
is very different from an American diet. And it seems to me, and I'm just going to ask you because I'm really not aware, do we see in China a lot of unhealthy people? And if so, why is that? Or is it the opposite, where they're much healthier than Americans? And do you attribute that not only to their sort of Eastern medicine thoughts and practices, but also their diet?
The Eastern diet, the Chinese diet, is mainly low, some carbs, but a very, very little amount of meat. And the Chinese people, they do take care of themselves. The tradition, you eat like in the morning, have a porridge or some eggs or something like that. Maybe tofu is a big diet, a big component of that diet. And you really eat well for lunch and dinner. You eat early, and a lot of people, even when they get older, they don't eat that much for dinner. But the thing is, there's a lot of vegetables. Even with the meat is it's like a cut very thin and mixed with vegetables. So you're not having so much calories. And in addition, it's a big country, to walk from point A to point B takes a lot of energy, versus where we are here, we get in the car from point A to point B and walk a little bit. So any kind of, we have Fitbit and other devices that tell you how many steps you make, which is really important. If you do 10,000 steps and more, and you burn more calories. It's basically calories versus what you intake. But what I do tell people, I ask them, my patients, I do ask them, what do they have for breakfast, what do they have for lunch, and what do they have for dinner. I basically say, eat like a king for breakfast, eat like a queen for lunch, and eat like Papa for dinner. So
that's interesting. Do you practice what you preach?
I try to, yeah. And also, this is not endorsing any products or anything. The Bulletproof Coffee is it's from Tibetan tea, and that decrease your craving for food up to lunch, and then increase your metabolism. I think that's a good way to start the day.
Yeah, many years ago, I read an article in the New York Times from the medical section of the paper, and the person who wrote it said something which I found very interesting, and I'm curious to see how you, what you think about it. And that is, she said, when you die, or before you die, you're either 10 pounds over your natural weight or 10 pounds under your natural weight. Does that make any sense to you at all?
You add 10 pounds or lose 10 pounds?
You could be. You're never going to be anything but either 10 pounds over or 10 pounds under what is genetically your body weight.
Okay. I
you believe that?
Yeah. I think of when you're young, it's really not about the weight. It's about the muscle. The muscle is it's how limber you are, how active you are. If you look at the way, somebody can be slightly obese, but they're not that heavy because fat is not that heavy versus somebody's all built Schwarzenegger. He's built and he could be very heavy, or your football players, they could be very heavy because muscle weight. It's how well your body is, the tone of your body, and how your clothes fit. That usually tells you. And when you're getting older, I would say past 70 or 80, and you don't want to be skinny, and because you do need a little bit. I've seen that because I do surgery. I do surgery on different people for different reasons, gynecological surgery, and people who are too skinny is not so good, nor are they too obese.
There you go. Which brings me to some of the very technical things of your profession, which is the issue of women's incontinence and prolapse. Now, what I would like you to do before you really answer the question, I'd like you to define incontinence, and I'd like you to define prolapse.
Okay. A lot of times patients come to me and saying that, doctor, I have a ball in my vagina. And they have a couple of kids or a few kids, and then now they're postmenopausal, and they could be a little bit heavy. And those are the people you look for prolapse. 3 things. The gravity that you cannot change, giving birth that you can change, and lack of estrogen of your vagina. So that in those kind of patients, they're most likely there's a prolapse. And then there's the incontinence. The incontinent patients, there's 3 kinds of incontinence. One of them, urinary stress incontinence. When these people have urinary stress incontinence, they cough and they leak. It's embarrassing. You could be sitting at dinner table and laughing with your friends, and you leak. And you have to, you have to go change or run to the bathroom. And or you doing jumping jacks, you do jumping ropes, and these people cannot do it, or they can't even run because they leak. That's the first kind. And the second kind is we call it detrusor instability, meaning that their muscle of the bladder is having spasm, or they're unstable. So these are the people, it's not a spasm, but it's unstable. What happens is that these are the kind of people, they go to the bathroom a lot. You ask yourself, I ask my patients the same question. When you go to the mall, do you know where the bathrooms are? If these people know where the bathrooms are, they have to stop and tinkle all the time. So they have this kind of problem called a detrusor instability. With this situation, it's really important that they're worked up and take medication, which is very helpful. And then you have people who had problems after, say, we call it an overflow problem. If they have neurological problem, or they're after a procedure. They cannot eliminate urine completely. So it's like water over the dam. So you only get the water over the dam, but you cannot eliminate your urine. So those are three kinds of urinary incontinence. And I encourage people, women who are having these problems, they should come to the doctor and have us work them up. There's so many ways we can help you. And we have pass-through, which is like a ring, or in the old way, like a diaphragm. We put it inside the vagina and push it up so you won't be having urinary problems. And there's medication you could take. And lastly, there's surgically you can help patients with these kind of problems.
Right. Women's sexuality. I would imagine when you're suffering from, as you said, incontinence or prolapse or any other gynecological problem, your sexual needs and desires, or not needs, but basically desires, must decrease. Is that so?
It could be. Not everybody's decreased, but definitely a lot of times they come to me with the urinary problems, and they will be, there is a smell to it, and there is a drop to it, and they don't feel comfortable having sex. That's unfortunate, and or they may have a rash down there because they're wearing the pants or poise and things like that, and it causes very much of an irritation, and having sex is not a good feeling. So, but again, when people are complaining about the decreased libido, which is the sex drive is not as strong, we always check them for, apart from estrogen, and we check them the testosterone level, the free and total, and making sure that their testosterone level can be increased a little bit, and maybe a little testosterone cream twice a week, and then they have the desire to have sex. But
so explain that to me a little bit more and to our audience. So you're suggesting that testosterone is the missing link between desire and actually having a good sex life.
Yes, testosterone increases your desire, but you have to have for a functional vagina, okay? I'm sorry to say that, but the vagina itself after menopause has very low estrogen, and they become very dry, and it shrinks. And so having a partner who's on Viagra wants to do it with you all the time, and a lot of people said, I feel like a knife cutting into my vagina. You need to prime that vagina to make it to make it moist and stretchy. The way to do it, you could do estrogen cream. There's 2 or 3 kinds on the market, and then you could do even for people who say they have breast cancer before and their vagina is so dry, it's just irritating. I would even recommend coconut oil every night. And
really?
Basically, yeah. And it's real easy, so not that expensive. So get a coconut oil, put in the refrigerator. It became large looking, and you do a blueberry size, put in the vagina every night. It's not as dry as it was before.
Interesting. So you're suggesting that there are actually ways in which you can get rid of the dryness and therefore have a better experience with your sexual partner. And it's simple as something like putting coconut oil. But that leads me to one other thing. Before before you answer that, you mentioned estrogen. And I know that I had a friend who actually wanted me to ask you about that. And what she wanted to know was, doesn't estrogen, if you have to take it because of these issues that we're discussing, doesn't it have a predisposition toward getting cancer?
Well, there was a women's health initiative many years ago, probably about 10 years ago. They studied that women who are on hormonal replacement therapy, which means the estrogen and progesterone combination. And in those days, everybody is encouraged to take hormonal replacement therapy. And these are the people with this combination, they have increased risk for breast cancer. And however, estrogen alone in their study, they did not notice that there's increase of breast cancer. Now we're not taking by mouth. We're only taking through the vagina. It's once a week. I tell my patient, once a week, a blueberry size of estrogen put in the vagina. You just smear around it, and it really doesn't cause cancer per se. However, let me be clear about this. If you do have breast cancer or you have family history that you may be a genetic, you may be a genetic carrier for BRCA gene 1 or BRCA gene 2 or Lynch or CHEK2. Those are the people who shouldn't be using any estrogen. I would advise them not to use estrogen in that situation.
Right.
Or people who have strokes and severe cardiovascular disease, I would tell them just use coconut cream and coconut oil, and that will at least alleviate that kind of pain. But there are other products on the market that you can try it, and but that's I think we have to practice safe medicine.
Yes, safe medicine is very important, and I'm glad you answered some of the questions that people will have regarding that. Now, gynecological surgery, you say that the availability of in-office versus outpatient options need to be focused on, and the pros of it are what?
Well, the in-office surgery, we do, we have in-office surgery, say if you have a normal pap smear, we'll do a colposcopy and a LEEP, which is remove top layer of the cervix. And sometimes if somebody who has postmenopausal bleeding, and we do a hysteroscopy, which is a scope. We place a scope through the cervix, look at the vagina, look at the uterus, and to check there's a polyps or any precancers or cancer, and that can be done in the office. It's very comfortably. Most of the patients do not have so much a problem. Bear in mind that if you go to the hospital, which some people have to, and going through anesthesia, it does, if you have tendencies, say, of Alzheimer's or dementia or something like that, it may not be too good for these patients. But if we have to, we will.
I understand. Just one last story that I want to discuss with you, which is a little bit different than things we've been actually talking about, but I think it's just an amazing story, and that's why I wanted to discuss it with you. And it's about the woman who was literally, she was dead, and she was pregnant at the time. I believe it was a certain accident that she had, and they were able to actually deliver the baby live. Have you ever seen anything like that?
Yes, I have. When I was a resident at Jackson Memorial Hospital, there was a young woman who had some trauma, and she was pregnant at the time. And she was in a coma, but the baby kept on growing. So we used to check on her, making sure the baby is in good condition. And we're able to deliver her. The baby was doing very well, and the mother, by the time of, I don't know how much longer she was, but we hope she will recover from the delivery.
How does that happen? Is the blood circulation in the woman's body still going on? And if she's brain dead, isn't the brain very important to this? I don't understand.
Actually, the human body is like like a cocoon, basically, that or like an incubator, and you don't really need so much. So long as the nutrition is provided through the mother, going the blood going through the blood, through the placenta, and provide to the baby, and the baby should be fine. Although we do worry about certain patients when they're in the hospital, what kind of medicine they give to the patient and not to harm the baby.
Wow, that's a really fascinating thing. Well, my guest today has been Xiao-Mei Zeng, who is a very, very interesting doctor who believes in so many different things. She's not set on only one thing. She understands the difference between Eastern medicine, Western medicine. She advocates for different holistic medicine situations so that people can really have the most they could get out of being healthy. And so I want to thank you, Dr. Zeng, for being on the Susan Brender Show. Come on again. We need all your information that you could give us, and it's appreciated. Thank you.
Thank you so much, Susan. Nice talking to you.
Thank you for listening to the Susan Brender Show. To be a guest, email sebrender@yahoo.com.